Welcome to another edition of 5 Talk Street. I'm Vince Sims. February is American Heart Month, a time the nation turns its attention to keeping families and communities free from heart disease, which is the #1 killer of Americans. Here to give us some great advice on how to stay heart healthy is Dr. James Park. He's an interventional cardiologist with Texas Health Dallas. Thank you so much for being with us.
Oh, thank you for having me.
All right, Dr. Park, let's just start with, first of all, what is heart disease?
Well, Vince, heart disease can take different forms. We can call it cardiovascular diseases, and that could include things like what we call coronary artery disease, which means buildup of plaque within the coronary arteries. And then it can also take in the form of heart attacks, strokes, and even hypertension or high blood pressure.
Now, saw a statistic that says cardiovascular disease claims more lives each year than all forms of cancer combined. Now, can you walk us through who can be affected by cardiovascular disease?
Well, it really doesn't discriminate against any specific person's race. It really affects a lot of Americans, Vince. In fact, if you can think about it, it gets a little bit missed because of other things that we hear in the news. Cancer death is very tragic, etc. But there's more deaths through cardiovascular disease than any other form of cancer. And in fact, there's one person that dies from cardiovascular disease every 36 seconds. And so 1 in every 4 deaths in America are due to cardiovascular disease.
Wow, alarming numbers right there. So what can someone actually do to prevent it?
Well, I think that takes form in many ways. A lot of it, even though I'm an interventional cardiologist, focuses around preventive heart care. And so I'll tell a lot of my patients that even though what I do best is to really open up these arteries when they're clogged, I really don't want to have to work on them if I don't have to. And so a key point to that, Vince, is really knowing about your actual risk. Namely, knowing about your family history, knowing about what kind of conditions that you have put you at risk. And that means, going to your doctors, knowing about specific parameters like your blood pressure, checking to see if you have diabetes or high cholesterol levels. And it's really something to focus on. And it's especially important, Vince, for women to focus on this because even though the American Heart Association has had a campaign for many years to identify heart disease in women, which were often missed. And even though they've had campaigns like that, I think a lot of women still don't understand that they're at risk from cardiovascular diseases. And that's hence why the American Heart Association has the Go Red for Women campaign.
And the Go Red for Women campaign, give us a little bit more information on that. What is that?
Well, it's just really informing not only the community and the public, Vince, but also the physicians, because some of the research studies show that in the past, doctors tended to overlook some of the symptoms that women had as symptoms that were related to cardiovascular diseases. And so there's been a lot of educational forums regarding that, both in the community and in the physician community. And women tend to have different symptoms. So a man might have a classical, what we call angina symptoms, and have squeezing chest pain, radiation down the arm, shortness of breath, maybe even jaw pain. But for women, they tend to have a little bit more atypical symptoms, maybe a pinpoint spot in their chest, maybe behind in their backs, between their scapulas. They might have jaw or teeth pain or neck pain. Also, a lot of women, a predominant symptom is fatigue. So I tend to ask a lot of these to women that come into my office for evaluation.
And I know that that's a lot for women in general. We're hearing a lot now about pregnancy-related cardiovascular disease and issues. Can you talk a little bit about that? That was something I wasn't familiar with when I was looking into it.
Right. It's kind of one of the newer sort of findings that, again, the medical community and the American Heart Association is trying to communicate out into the general public. Although it's not a lot of deaths, the predominant reason for pregnant or maternal deaths are related to cardiovascular diseases. And so we're finding out that we need to identify these mothers to be sooner and to get evaluation and health care to them that they need to avoid it. And the other factor that, Vince, is that most of these are preventable.
Now, Dr. Park, we were talking earlier about ways to prevent this, and I know that you mentioned family history, which that's something you really can't control. You just need to know about. But there are things within your control, as we're talking about education, lifestyle. Those are important things that you can control, correct?
Absolutely. So, Vince, again, when a patient comes to me in my office, I talk a lot about things that we can control. And even the genetic factors that we can't control, they're modified if we do all the right things. And so that comes down to all the basics that we talk about. That means having better diets, making sure that you're being active and doing physical exercise, making sure that you're getting good rest, making sure that you're not under stress. Stress is a big component, I think, in a lot of younger people. And then knowing about your risk factors, such as your overall cholesterol, your blood pressure, to make sure that you're not a diabetic or pre-diabetic. And if you are, you really need to control these very aggressively, because a lot of these factors affects your body daily, every second, every minute. And so you'll have decades of these conditions that you need to manage. And so the better you manage these, the better you'll be off and avoid the reasons for cardiovascular deaths.
And you want to give some information here. What are some signs of a heart attack, and can this differ between men and women?
Yes. So as I mentioned before, the difference between men and women are men tend to have more classical symptoms. So they'll have what's called the Levine sign, a squeezing of the chest, almost feels like a fist-like squeezing of your chest, a pressure-like sensation. Sometimes they'll have radiation down the arm, and they'll have shortness of breath. Sometimes it's associated with nausea or vomiting. Women tend to have more atypical symptoms, very pinpointed areas. It might not be actual chest pain, but maybe more back discomfort between the scapulas. Sometimes they'll have just generalized fatigue. And so in women, it tends to kind of hide a little bit. So you'll have to do a little digging and making sure that they don't have active symptoms related with either heart disease or an actual heart attack.
Well, Dr. Park, we want to thank you very much for sharing this very valuable information with us today.
Okay, good to talk to you, Vince.
Yes, sir. And, you know, if you would like more information on the Go Red for Women campaign and Heart Month, all you have to do is visit heart.org.